finished 4 episodes, which is introductions, food, sleep, and we're coming to now movements, exercise, and yogic science के बारे में भी अगर आप थोड़ी सी बात कर लें, that will be very nice.
Yeah, absolutely. So I think, as we said, we're talking about is you, your health, and the gap.
Yes.
And your role in health. And what are the components which are well studied, well established, which brings health. And his health is health promotion, illness prevention, and some chronic disease management. So much so that in proper hands, because type 2 diabetes is a very complex thing, and certain types of subsets of type 2 diabetes are reversible. So there is hope at all stages. If you follow these, you delay onset of diabetes and chronic diseases, or you have it but it's less strong, just like vaccination, or if you have it and if you have the right subset, it is reversible even by lifestyle. Obviously, pharmaceuticals and pharmas are very important, and your doctor is the best judge on it, when to use, what to use. So today we want to talk about is exercise and movement, because again, just like food, stress, and sleep, all these are related to biological energy.
Right.
So movement is directly linked to what happens to when you eat food, and flexibility of the joints, the movements of organs and muscles and fascia and ligaments. They all helping you in better metabolic machinery. So that's why you need to maintain a movement. For example, if you don't do much exercise, your bones or joints get very rigid, then you have pain or inflammation with it, and that's no fun. So everything slows down. Body starts to react. So you want to keep healthy that way.
So when people are working or are younger, the movement is there. When people get older, the movement reduces a little bit, maybe because we put on a little bit of weight, or maybe it's the type of lifestyle that we have, sedentary, we are not moving a lot. So exercise in that particular case comes in very handy. Should it be done, then exercise should be a part of our life. When should one do exercise?
Absolutely. So I don't even use the word exercise.
Movement.
Because it's kind of a punishment. So I think what we should think, because your health, and the gap, why you as a person should be healthy, and why you want to be healthy.
Right.
So the big thing is you want to be healthy, of which movement is very important. Now, the nice thing is that a young person, they need more movement than, say, older person. So you could get away with a lot more.
Yes.
So it's not that you have to do the same degree or intensity. And then movement is very much related to your joints and the muscles which it feed. So I think if you don't do exercise and you continue to eat same amount of energy you were eating, most of that energy is extra, and then body doesn't know what to do with it, and that goes to fat. And so now you're starting the inflammation and all those things we've been talking about. So exercise is movement is very important, and movement for just walking and being active. And I think we are gifted with the knowledge of Indus Valley Vedic yogic science and the protocols on yoga. Yoga is the perfect movement, because it is not just yoga, a movement, but it ties into breathing. So all the movements and asanas, we call it, they are tied to breathing. And breathing is a rhythm of inspiration and expiration. And during that thing, your body starts to have certain cycles. It's all about cycles and the energy and how body cycles work. So I think yoga, I would say, is simple yoga. And now they have come with so many things. You don't have to be torturing your body. That's the
Right.
last thing, you know.
But having said that, Dr. Saab, when you do yoga asanas as a child or grown up, obviously your body is limber, and as you grow older, your body starts becoming, as you mentioned in your own words, a little rigid
Oh, quite a bit rigid, yeah, and some parts more rigid, but
than others.
yeah,
So, for that, every day stretching can be a part of your exercise.
yeah, absolutely. As a matter of fact, simple stretch is as good as anything. And stretching, standing up, stretching sitting down, stretching lying there, and stretching on your back or your all those. The international protocol of yoga covers all of those.
Right.
The big thing is you have to, if you're going to do that, you have to do it right.
Hmm.
You have to know, because certain amount of intensity has to be there.
Right.
Certain amount of duration has to be there, because it's all built into relating to the body and the physiology.
Right.
So you don't get it if you don't stretch long enough.
Ah.
So you, general routine is that it's better to do one or two asanas, but do them properly. There's no point of doing 20 of them
Yes.
and then not enough time, right?
That's right.
And all you need is 20 to 30 minutes a day. That's the other thing. Exercise or movement is not something you did 2 hours today and then you're good for 5 days. It has to be every day. It has to be a rhythm. 20 minutes a day is better 5 days, 6 days, 7 days than 2 hours per one day and not enough for next few days, you know. So
Couple of things that come with this. People get onto running a lot and doing 5K and 10K, whereas I personally feel that if they walked every day instead of running, that might give you the same result.
So I think there are two different things, right?
Yes.
We are talking about the physiological need of the body to
Yes.
be healthy.
Yes.
The other is sense of achievement and going and doing something which you want to do. So I think long runners, marathons, and all the athletes, they're doing that level more to meet certain goals in the life. You don't need that to be healthy. You know? Basically, all you need is, especially you grow older, and other thing, Shishmaji, is it's very important. It's not like, yeah, I do this, but I don't have to do this.
Right.
All 4 elements we talked about, you have to be with them, and you have to be consistent, and you have to be persistent. So movement, the big trick is every day.
And make it a habit.
Yeah, exactly. And simple things.
Yeah.
If you decide 20-minute walk in the woods, that's good. I've now got into real asanas and pranayams and rhythm of that, and it tough and you feel, but it has to stay with it. And there's so many programs now, so you could do them at home. You don't even have to leave home. And a Zoom. And I'm subscribing, besides, as you know, Nutanji have the Arogya program, but I subscribe to a program which comes from India, and it's fantastic. Has very flexibility. He records it and then plays at least 6 times, different times, so it suits you. And for me, 4:30 in the morning is the best. And I think I'm on, I just started 200 days ago, and I'm on 200 days now.
Wow, that's fantastic. I also want to bring in here another aspect of movement. And apart from yogic postures and your movement in that aspect, Tai Chi is another one that gives you the same kind of results.
Any of those, and as a matter of fact, it all depends on the individual. The main thing is that you like it, you enjoy it, and you're doing it to be healthy, and you're determined. Whatever it is, you should do. Tai Chi and then other traditional Chinese.
Yes.
And even in India, beside yoga, they have others, and
Right.
Arabian population has there. So they all have it. And now we also have exercise machines.
That's
and
right.
So some people like that, you know. So whatever you at this stage or the stage you're at, you like, most important message is you need movement. It's part of health. It's part of exercise. And be consistent, be persistent.
Dr. Saab, I also wanted to find out from you, you talked about doing movement. You said also that keep it in a habit of doing it at the same time. Should it be done once a day, twice a day, 3 times a day?
Well, again, it depends on your lifestyle, depends on the opportunities. And if you are using yogic science to do this, the beauty of yoga is you do it when it's convenient. So you do some, still you haven't got out of the bed, you could do them.
Yes.
And some you're sitting and then you could do it. And there are protocols, and I think make sure you learn from the right teacher.
Right.
The important thing, yogic science is you have to do it right.
Yes.
When you're stretching, there is a way to stretch.
That's right.
And it has to rhyme with your breathing.
Yes.
Because otherwise you don't get the beneficial effect. Because what it's really doing is, besides providing physical mobility, besides providing muscle relaxation, besides providing flexibility in the body, it's also giving you emotional support.
Right.
And it also working on breathing, especially the pranic energy, which also makes the move go. You know, we're talking about physical movement, but body, as we know, has a lot of movements. Gas moves, and all you have to do is the blockage of the gas, and you feel the pain, you know?
Yeah, that's right.
And the fluids moving.
Yes.
So not only bones and joints have to move,
Right.
but everything in the body has to move.
Okay.
And that is greatly helped by certain amount of exercise or movement.
So now in movement and exercise and yogic postures, 3 things have come out that to move, you can either do the exercises and stay with them.
Or even simple walk. You
Simple
know.
walk, okay. Now, apart from all this, a physical movement that we are talking about, how does that physical movement help us with our health? What is it doing?
Yeah, there is a direct relationship, as I said.
Yeah.
Because when you're doing movements, body is, again, if you want to think of it, 3 components.
Right.
Physical or physiology or physics.
Yes.
So the waves and energy and frequencies which interconnects the body. And movement does that. And when you move, you have different bodies. And in yogic science, at least, because you relate it to breathing, so now you're taking it a different level, so that's how it helps. Biochemically, moves creates a different metabolism, so you don't get fat, and your muscles are strong, and your proteins, that's why it's everything related. You have to have enough proteins, you have to have enough carbohydrates, you have to have enough fat. You can't have too much of one or the other, because muscles need protein or amino acids which come from protein, and if you don't have muscles, you get rigidity. So I think that's how movements work. And most of the yogic exercises are stretching or isometric, where you're stretching but no movement. Really helps all those kind of things. So definitely a big part. And I think if you are doing the movements and you have a certain amount of flexibility, then you are able to achieve a lot of things in life, so you feel good. Because, you know, if it takes you so long just to walk a little bit, then it gets hard, right? So as long as possible, one should do that. And I also appreciate that some of the degenerative diseases and some of the diseases make it impossible, but try as much as you can.
Okay, no program is complete without me asking a silly question. So here we go. when you're doing all these exercises and you say, for example, you're going to be walking away, you say, okay, आज मेरी exercise walking है and मैं खाना खा के will just start walking. What kinds of foods would help you and what kinds of foods are not very good for the body that you're doing exercises? खाना खाने के बाद कौन सी ऐसी चीज़ है जो आपको नहीं करनी चाहिए जो कि आपको hurt कर सकती है?
Yeah, the restrictions are limited, and I think the only restriction is do whatever you're doing that you enjoy it.
Okay.
That's the key. So if you like walk in the wood, you should do walking. But see, the other thing is society has to have facilities, you have to have trails, you have to have roads, traffic has to be right. Yoga you could do at home. You don't have to worry about all kinds of Zooms are available now, and 20 minutes of that. So whatever works. Some people have home exercise rooms and they have gizmos there, so they could do that. So again, my point of view, you have to be aware. You have to put everything together, and you have to be wholesome life where everything is integrated. So for me, it's the shift. The gap and integrative thinking.
So in our podcast, we've covered the introduction. We've also covered food. We've covered sleep. We are today talking about movement and exercises and yogic science included in all this. We've got two aspects that we haven't touched, and we'll do that in the next two programs.
One is stress and emotions and relationships.
That's right.
Because they're tied in, and then we want to put it all together, a bit like a tool.
That's right.
What you have to do in a day.
For mental well-being. Dr. Saab, thank you so very much for taking time in this particular program. I have some other questions which are not related to our podcast, and I will ask you those right after this short commercial.
Yeah, time goes fast,
It does.
40 minutes have gone, 20 minutes each, and thank you very much, Sushmaji, for bringing this to our people, and I just hope that it's of some help to people, and they could get in touch with you if they have any questions.
Thank you.